Why is fat a problem? Hi guys, I get a lot of patients in clinic and we have to address an uncomfortable truth or a concept. When you've got patients coming in and they have pains, I reckon in fair estimation that their injury is their fat either contributes to the injury or maintains their injury in a significant proportion of my patients. It's a fair question I get asked, and then it's an explanation I have to give. So I thought I will shoot it out on social media and we can have a bit of a discussion. So what is fat? Fat is not just a benign substance found around the midriff. It is a living, breathing, secreting structure, and we've come to know a lot more in recent years about it. So when people have fat, especially around the midriff, so it releases certain chemicals. We measure these chemicals. So it releases what we call cytokines, so interleukins 1, 2, 6. It releases a TNF. It releases leptins and adipokines called adiponectin. So these are the kind of the chemicals that it releases, and so most of these chemicals are pro-inflammatory. What it also releases is, it's also a repository for toxins. So especially in today's world where there's a lot of exotoxins around our environment, and these toxins we eat, we breathe, and we absorb them, and when we do, they're stored somewhere, and they're stored within our fat cells. So quite often we have to be careful with this, because when people are losing weight, they can be excreting these toxins out through into their bloodstream, and we've got to be careful of how much fat, how quickly they lose, because of the negative consequences of a toxic overload. But anyway, so when you get injuries, and when you get injuries, especially we talk about injuries into the hips and lower back. So for predominantly my female patients, when they come in with hip and lower back pains, so females generally relative to males have higher fat ratios there. And we've got to ask the question with some of the patients, how much of the injury is maintained by the fact that there are elevated levels of inflammatory markers. There might be subclinical, so that people don't need to be medicated for autoimmune diseases, but certainly you see it on research that these levels are elevated. An elevation of, and what that causes is an aggravation of the bones, the ligaments, the tendons around that area. Why? There's one really good quality research article coming from a team in Poland which shows some of the theories behind this. So what they were narrating is the key concepts of why people get these low-grade inflammations. And when you get fat, of course fat has blood vessels in and around it, and those blood vessels then invaginate into the bone tissue. So if you've got these fat cells and they're releasing these cytokines, these interleukins and other chemical markers, they'll actually, the first place they will be released is into the bone, the surrounding bone. And as some of my patients know, with my, say for example, my bone needling or my constant talk about the lining of the bone called the periosteum, I usually give the analogy of the crunchy bar of chocolate with the foil wrapping, and the foil wrapping being the periosteum. So that's, and the fat cells and the blood vessels from there would invaginate and go into there, and those chemical inflammatory markers will constantly be at a subclinical level aggravating that area. And this is why you can often get this low-grade ache that just seemingly lasts, and it can be quite difficult to treat. So of course we treat it structurally. There's stuff we do to help the cells and decrease the chemical potential of a cell, etc., etc. But if you're constantly getting this low grade inflammatory stimulant in there, it's going to be very hard to deal with it long term, unless for some of the patient groups we do lower the fat cells around there. Now there's been more positive research coming out in terms of the previous old theory was you develop the set number of fat cells until adolescence, and then whatever number of fat cells you had, that's it. And you fill those fat cells with the food you eat, and then you have to, so if you're an obese child, then you've got more fat cells, and then it's harder to then lose fat. But we know that there's been a better, newer theory out there, so it's debunked the old one. Fat cells can still be made in older age, and they can be lost in older age. So really we should find that there is not as much of an excuse, so we should be able to still lose fat cells. This is highly positive as a clinician for my patients, so we should take a lot of good in that. The other interesting thing about fat, on a side note, is don't forget it's a living, breathing structure. We have around, 60,000 to 100,000 miles of blood vessels in our body. That's a serious lot of mileage of blood vessel. That means it wraps around the world like twice over. That's how much blood vessel pipage we have in our body. Imagine our hearts are the size of our fist, having to pump blood through around the earth twice effectively, right? When we have extra fat, then we have extra thousands of miles of potentially of blood vessels. The heart has to pump that much harder, and of course we can lead to hypertension, high blood pressure, which is one of the major silent killers. So all my patients out there, every now and again get your blood pressure checked. I never forget this one patient I had in clinic. I used to hint to them quite often, and I used to kind of try to encourage them to maybe take their, I thought they had primary hypertension and they didn't take the medication. I used to try and encourage them to try and explain to them, if your blood pressure is high, you can't have too much pressure going through the pipes, because the pipes can burst, and often they do burst. And bless his soul, he was quite adamant he didn't want to take the medication. He's fit and healthy, and I always used to worry in the back of my mind that he's got really high blood pressure, trying to gently tell him over the years as I used to see him on and off, until unfortunately one day I heard he had a stroke. But now I hear that on full recovery, that he's on top of his medication. So it's one of the ones we do really encourage people, listen to your healthcare professionals and take the medication. Don't go around with elevated blood pressure, try to reduce it. But anyway, so we have this, with being overweight, you have this elevated blood pressure, you have this inflammation being released into the bloodstream in and around that bone area, that then causes you an ache. I forgot to talk of this. The other thing it does is it increases CRP levels. So this is in the GP surgery, you can get your CRP levels measured, indicator of inflammation. Interestingly enough, if you had any of the talks on magnesium that I did, low levels of magnesium is inversely correlated to a higher CRP level. So, how often do we talk to patients about, well, you have autoimmune diseases, well, you have inflammatory counts which are a little bit high. Well, potentially elevate your magnesium levels. So it's a complicated one, but all of us, if we can try to, depending obviously how much fat we have in our bodies, to try and reduce some of the percentage body fat, especially around the midriff. So the midriff body fat is more associated with men more than women, and if midriff fat is more associated with increased level of glucocorticoids, so we find that in diabetes, cardiovascular disease, indication of pre-diabetes would be slowly the midriff growing. So we need to take extra care as guys because we're more predisposed to this than females. But the other thing is, what else is, so, sorry, when people come into clinic and they've got aches and pains, and we say, yes, those are the reasons for the chemical level, of course there's a structural level. So weight weighs you down, and that can have an extra load on your tendons, your ligaments, and they can indeed have an extra load on pulling of structures, which can then cause a mechanical ache. So those are amongst the reasons we try and encourage people to drop their weight as much as possible. But we understand these aren't easy. It's never easy to do. I mean, I myself included, carrying a bit too much right now, especially with lockdown. I seem to have been locked down in my fridge. So I need to, that's why I'm taking these long walks and trying a lot. But I'll blame my mom for making too much nice food. The other thing is, overweight is seriously complicated, because having elevated inflammatory counts also has been shown to decrease the brain size, the brain volume, the grey matter. So all of what I say, it's research based. So we find literally a shrinking of the brain by long-term being fat. Not only that, we find links to Alzheimer's and major depression and increased risks of bipolar. So for future health, what do we find? We find one of the biggest growing killers in our society is it's overtaking cardiovascular disease, is brain disease. And amongst those are like Alzheimer's disease. You know, you'll see these like things to call amyloid plaques and buildup of plaques in the brain. Well, we've got direct links now with the research on fat and the chemicals fat releases, the fact that those chemicals go into the blood, then they go through the blood-brain barrier and they can go into our brain and inflame the brain. In fact, a good night's sleep helps what we call the protective lining around the brain, called the astrocytes, to slightly shrink and allow our bloodstream and immune cells in our brain to deal with that. So another big part, if you ever listen to any more of my talks, I'll talk about sleep, why sleep is important, because it helps fix us, and literally it helps our immune systems even fix parts and deal with inflammation and damage in our brains. So yeah, this is how we find we've got to, when we're dealing with people's aches and pains, we've also got to be dealing with them in a holistic way. How do they sleep? How do they think? What do they eat? You know, what they're pooping. We've got to deal with it all, basically. Thank you for watching, and hopefully follow me. I'll try to post this out in as many forums as I can, share them and comment and tell me how you get on with these videos, and I'll try to release more information. Thanks guys.